Helping Babies Breathe, a training being conducted by the Ministry of Health in collaboration with the PAHO WHO, aims to build the capacity of nurses and other healthcare workers to ultimately reduce neonatal mortality. Health Minister Dr. Frank Anthony noted that while it refers to the first 7 days after birth, the first minute can determine whether a child lives or dies.
And therefore, if we pay attention to that, we can actually make a big difference. And so this training that you'll be receiving is to help you to identify those risk factors early and to take actions as quickly as possible so that you can save that child's life. And once we're able to do that and implement this program on scale, we will be saving lots of lives.
The minister noted that the training techniques were developed by the American Academy of Pediatrics in 2010 and have a 47% reduction rate in neonatal mortality. The program is now being rolled out in more than 80 countries around the world, including Guyana. While some of the techniques are already performed in Guyana, more people need to be trained.
If you think back about 10 years ago, at the Georgetown Public Hospital, we had 2 pediatricians. We had an NICU that is level 1, so they weren't able to do to help babies who had problems with breathing, because level 1 is the basic NICU that you can have. We have since changed that, and we now have a level 4 NICU at the Georgetown Hospital. We have at least about 22 pediatricians now at the hospital. And over the period, we would have trained 70 NICU nurses. And the impact of that is that our neonatal mortality is now 6 per 1,000 at the Georgetown Hospital. So there's a big difference.
Neonatal mortality in the country stands at 19 per 1,000, while hinterland neonatal mortality is approximately 30 per 1,000.
Now we can change that. We can change that by our approach, by making sure that we can extend our NICU services to all regional hospitals. And so we have already started doing that. We have an NICU now at New Amsterdam, we have one in Linden, we have one in West Demerara, and we are expanding them. In fact, I think we now have about 6 NICU in these different regional hospitals.
The ministry has also been working to ensure that pediatricians with neonatal training be placed at these facilities, along with nurses. In the next 3 years, the ministry is looking to have functioning NICU in Mabaruma, Partika, and the Lethem hospitals.
We expect that in a couple of years, we should be able to narrow this gap that I spoke about. So we have demonstrated at the Georgetown Hospital that we can get these numbers down to single digit, and we want that for the rest of the country. So with this combined approach of what we are doing in our hospital institutions and at the community level and so forth, I think by combining our efforts, we can make a big difference.
The maternal and pediatric hospital, which is soon to be constructed, will have a neonatal care unit. The training is only part of the process to reducing neonatal mortality in Guyana.